The public health system in New Zealand is divided up into 20 regions, and those are called district health boards.
Canterbury District Health Board is the largest district health board in the South Island. West Coast is the smallest district health board in the South Island. Some of the patients from the West Coast have to travel to Christchurch for services.
And it's not uncommon for roads over there to be blocked by slips or washouts for periods of time. What that means is that we have to find some other way to try and bring healthcare to them. So when people say telehealth, what they usually mean is delivering healthcare to distant populations using some form of electronic transfer of data.
You know, it's a unit, it's got a screen, it's got a microphone. Very simple and easy to make a call or accept a call. The screen quality is really good, it's clear, you can see, and the connection is clear. There's hardly any delay, if any delay. It's like being in a normal consultation.
So there's a family from the West Coast who had a daughter, Tasia, who was 3, who was being looked after in the pediatric oncology unit in Christchurch.
We were in Christchurch going through Tasia's treatment. Piper felt ill in Greymouth and she had to be put into Greymouth Hospital.
And she got a condition called hemolytic uremic syndrome, which meant that she had to be transferred over to Christchurch. What we were able to do before we went and picked her up was let her parents see her by video conference, so they could see that she was doing fine. They could understand why we needed to bring her to Christchurch.
We were at Christchurch Hospital on the telehealth talking to Piper, and she got to see her talk to her dad and her sister. And if we didn't have telehealth, that way we would have had to make numerous trips to Christchurch before Tasia started her treatment to just sign documents and papers. And then when Piper felt ill, being told you need to hop on a plane and come and pick up your daughter, having not even seen her, talk to her, so to be able to see her on the TV was just amazing.
It's true to say that paediatrics is a very visual specialty, and we get a lot out of being able to see children to tell whether they're well, unwell or sick, and that's the kind of thing that's very hard for people to describe over the telephone.
But with telehealth, you're actually working directly with the consultant. Everybody's on the same page, everybody's going to work together to achieve the outcome.
So video definitely has changed the way we work. I'm here at home now. If someone phones me tonight about a child on the coast, I can still see them without having to go back into the hospital. It is very easy to use, so because we've got directory dialing, and I can see all of the sites that I might need to call, and then being able to operate the camera at the far site from here means that I can look at what I need to look at without having to ask anyone at the other end to help out with that. We're able to see more children in the outpatient clinic, and one of the things that I was struggling with was being able to keep up with the number of children that we needed to see.
So there's a mix of metrics that we're using to look at the effectiveness of our investment in telehealth. So first of all, it's patient's time. The other is around staff time, clinician time. The use of telehealth has certainly meant that people are getting a continuity of service that they wouldn't necessarily get. We certainly believe it's a smart investment.
5 years from now, I think that video conferencing will be across all specialties, and nationwide we'll be seeing about 10% of patients in an outpatient clinic by video conference. And there'll probably even be some work starting to be done into patients' homes themselves, so that they really don't have to travel too far at all, if anywhere, to get seen.